People often say, oh, doctors, they don't know anything, don't listen to them. And one group got the new drug, while the other group got the standard drug. Hi friends, I'm Filip, a medical doctor and PhD student here in Croatia, and on this channel you can join me on my journey through medicine and science. What I want to do in my clinical practice when treating patients, first of all, not to harm them, and second of all, to improve their quality of life as much as humanly possible. That's what essentially my job is. And how can I do this when there's all sorts of conflicting information, a mountain of textbooks? What should I base my decisions on? There's a whole science behind answering these questions. The basic building blocks of evidence in medicine are randomized controlled trials. Let's look at an example. Recently, in the field of cardiology, which is something I'm interested in, there was a big randomized controlled trial called Paradigm-HF. This trial enrolled a bit over 8,000 patients and wanted to see whether a newly developed drug was better or worse or equal to the standard drug which had up to then been used for the treatment of patients with a certain heart disease called heart failure with reduced ejection fraction, which essentially means that the heart doesn't pump as strong as it should. And this is a disease which is quite deadly, it's quite serious, why seeking a new drug made sense in the first place. So what happened in this trial was that a total of 8,399 patients participated. All of them had this specific heart disease which was of interest, and these patients were then split up into two groups. Around half of the patients ended up in each group, and one group got the new drug while the other group got the standard drug. The way in which patients were allocated to either of these groups was based on a random procedure, so like flipping a coin. Once the patients were included, this was considered day zero, and then they were in regular checkups at specific time periods until the end of the trial. The events of key interest in the trial were either death due to cardiovascular causes, hospitalization due to disease worsening. If a patient had multiple hospitalizations, then only the first one was counted. Now, what we saw at the end of the trial was that there were 914 patients in the new drug group which experienced either death due to cardiovascular causes or hospitalization due to disease worsening. And on the other hand, in the standard drug group, there were 1,117 patients. Now, already we can see the difference between these two numbers, but a much more informative measure would be to see how long it took them from day zero to the occurrence of either one of these two events. So if 914 events took place in this group, we would note, okay, the first event took place after, say, 2 weeks, the second one after 3 weeks, etc. And we would do the same for both groups. And then we could incorporate this information, total number of events in each group, into one measure, a hazard ratio. So what a hazard ratio is really just the ratio of two hazards. One hazard is the hazard of these two events happening in patients who are on the new drug, compared to the hazard of the same events in patients who are on the standard drug. And the result of this trial showed that the hazard ratio was 0.8, which means that the hazard of the new drug was 20% lower than the hazard of the standard drug. In other words, the risk of death due to cardiovascular causes or first hospitalization due to disease worsening was 20% lower with the new drug compared to the standard drug, which is a pretty impressive result in terms of efficacy of the drug. And indeed, this was one of the breakthrough trials in cardiology in the recent years. We can look at this from the perspective of a patient as well. If a patient is given an option to choose either the standard drug and its efficacy is also proven, etc., or they now have the option to also choose the new drug, which lowers the risk of these events by 20% compared to the standard drug. So that's basically what evidence in medicine looks like. It's upon these randomized controlled trials, mostly, with additional types of research also involved, that expert groups usually meet every 5 years or more often if necessary to produce recommendations to doctors regarding which drug to prescribe for which disease. For example, the latest guidelines for the disease studied in Paradigm HF took into account the results of that trial, and that drug is now one of the recommended drugs to be used in patients with this disease. If you want to check out the guidelines I just mentioned, they are free and you can find them in the description box below, as well as the link to the full Paradigm HF trial, which also included some additional analyses. And I'd just like to emphasize that this isn't just in the field of cardiology. This applies to all fields of medicine, be it a disease of the skin, lungs, kidneys, whatever. This is the basic building block of modern medicine today. I rely on these trials to make my decisions, and it's not absolutely necessary for me to follow each and every trial which is done, because all of these trials are summarized and presented in a concise manner in these guideline documents, which are arranged by expert groups, as well as dedicated platforms keep track of all updates on a certain topic and then also provide their own recommendations. New trials are constantly being started, old ones are finishing. The body of knowledge that medicine relies on is constantly growing, and a good medical doctor, if we want to call it that, is always up to date with the newest guidelines, etc. And the guidelines are really only a recommendation in the sense of pointing you in the right direction. They're not strict rules, because as we know, each patient has their own needs, different reactions to the same drug in the same dose, and there's a multitude of factors to take into account when treating a single patient. Guidelines are really what I should be focusing on as a medical doctor to learn how to treat patients. So I'm curious as to what your opinion is. Do you think doctors know anything? Let me know in the comments, and also check out my video on vaccines and autism. And don't forget to subscribe and hit the bell. I'll see you later.